Hello, my name is Liz Montel, and this is my Pediatric Nutrition in Service project, specifically over PCOS. Starting with how PCOS is defined, polycystic ovary syndrome is a problem with hormones that happens during the reproductive years, characterized by having irregular periods, excess androgen levels, and small sacs of fluid that develops along the outer edge of the ovary, and these are called cysts. The small fluid-filled cysts contain immature eggs that are called follicles, and these follicles fail to regularly release eggs. So, moving on to some symptoms that women who have PCOS may experience, they can vary. A diagnosis of PCOS is made when you have at least two of these, though. One of them being irregular periods. So, having few menstrual periods or having periods that aren't regular are a very common sign of PCOS. Also, having periods that either last for many days or are longer than a typical period. Another symptom would be having too much androgen. High levels of the hormone androgen may result in excess facial or body hair. Sometimes there can also be severe acne or hair loss because of this. Polycystic ovaries. This is where your ovaries may be bigger, and many follicles containing immature eggs may develop around the edges of the ovary. And because of this, the ovaries may not work the way they should. And PCOS signs and symptoms are typically more severe in people with obesity. Causes of PCOS. The exact cause of PCOS isn't known, but there are some factors that may play a role. Some of these would include having insulin resistance. Too much insulin might cause your body to make too much of the male hormone androgen. This could cause trouble with ovulation, which is the process where eggs are released from the ovary. Having low-grade inflammation. White blood cells make substances in response to infection or injury. This response is called low-grade inflammation. Research shows that people with PCOS have a type of long-term low-grade inflammation that leads to polycystic ovaries to produce androgen. This can lead to possible heart and blood vessel problems. Heredity is another one. Research suggests that certain genes could be linked to PCOS. Having a family history may also play a role in developing the condition. And lastly, excess androgen. With PCOS, the ovaries may produce high levels of this. So having too much androgen interferes with ovulation and means that the eggs don't develop on a regular basis and aren't released from the follicles where they develop. Moving on to some complications of PCOS, one of the big ones being infertility. Another one is having gestational diabetes or pregnancy-induced high blood pressure, miscarriage or premature birth, non-alcoholic steatohepatitis, which is a severe liver inflammation caused by fat buildup in the liver, metabolic syndrome, a cluster of conditions including high blood pressure, high blood sugar, and unhealthy cholesterol or triglyceride levels, type 2 diabetes or prediabetes, sleep apnea, depression, anxiety, eating disorders, cancer of the uterine lining, which is endometrial cancer, And obesity commonly occurs with PCOS and can unfortunately worsen complications of this disorder. Moving on to management of PCOS. A primary goal of PCOS treatment is to increase insulin resistance through healthy dietary patterns, weight loss, and regular exercise. Weight loss as low as 5% of initial body weight has been found to restore regular menstrual periods. It improves insulin sensitivity and helps lower blood glucose, insulin, testosterone levels, and supports the normalization of ovulation. Most women with the syndrome can conceive and bear children, though. So, also, care must be taken to individualize eating and exercise plans if weight loss is to succeed. PCOS is a long-term health problem that requires a sustainable approach. In addition, women may benefit from knowing more about PCOS, long-term health risks, and why weight loss and exercise may be needed for them. Can PCOS affect pregnancy? Women with PCOS may find it harder to fall pregnant and may have a higher chance of having pregnancy complications. So, because of this, it's important to see your doctor during your pregnancy. Having a medical professional who has a close watch on you is very beneficial for preventing as well as managing problems should they arise. Women's PCOS symptoms can also change based on things that affect their hormones. Things would be pregnancy, that really affects hormones, gaining or losing weight. Possible complications of PCOS during pregnancy. Having PCOS can increase your chance of these complications: having high blood pressure and preeclampsia, gestational diabetes, miscarriage, premature birth, and cesarean birth. If you have PCOS and are pregnant, it is important that you talk to your doctor. You can reduce these chances of pregnancy complications by monitoring your PCOS symptoms, taking extra care during your pregnancy. So, your baby may also be larger than usual for their gestational age. This makes it more likely that you will need a cesarean birth. Babies born to people with PCOS also have higher chance of being admitted to a newborn intensive care unit. Now we're going to move on to some core nutritional strategies, dietary foundations for women who have PCOS during their pregnancies. So, starting with some good foods for PCOS management. It's recommended to have whole, natural foods that fuel your body over longer periods of time and help to avoid spikes of glucose and energy. So, incorporating foods that contain more protein and fiber, which slow the release of glucose into the bloodstream. Some examples of these would be green leafy vegetables like spinach, kale, lettuce, foods that are rich in fiber, such as berries, whole grains, beans, and apples, fresh foods that have not been processed and are as close to whole as possible, lean proteins such as beans, legumes, nuts, and fish, non-starchy vegetables such as peppers, broccoli, cauliflower, mushrooms, snow peas, and celery. And lastly, whole grains such as whole grain breads and pastas, brown rice, and barley. So, foods to avoid with PCOS. trying to limit foods that specifically tend to spike your glucose. These would be packaged processed foods, for example, chips. If you can't read or recognize the ingredient on a food label, that food is most likely a highly processed food. Other foods to avoid would include foods with refined flour, such as white bread, pizza crust, and pasta, fried foods, red meat, and processed lunch meats specifically, saturated fats such as butter and margarine, sugary drinks such as sodas, teas, or sports drinks, sugary snacks such as candies, cookies, and cakes, and lastly, white rice. So, there are some key supplements recommended for women with PCOS. Of course, this is after consulting with your doctor first. So, some of these recommended supplements would be vitamin D, which is a big one because often women with PCOS are deficient in this, and it's really crucial for their hormones. Omega-3s, like fish oil. This is important because it helps with reducing inflammation and also supporting fetal brain development. Inositol improves insulin sensitivity and ovulation. And lastly, a prenatal vitamin. This is essential, especially with at least 400 mcgs of folic acid. So, some recommended dietary patterns. Research has shown that Mediterranean, low glycemic index, and ketogenic diets that are modified specifically with individuals in mind are the best ways to help with resolving insulin resistance, obesity, and the lack of ovulation. Other nutrients shown to affect glucose metabolism and play a role in hormone regulation are the macromolecules, such as increased protein and reduced refined carbs. So, to go deeper into those diets that we talked about, the first one was the Mediterranean diet, and that emphasizes whole foods, healthy fats, fish, and plant-based proteins. The low glycemic index diet focuses on foods that cause a slower rise in blood sugar. And the ketogenic diet is a low carb, high fat, moderate protein eating plan that forces your body to burn fat for fuel instead of glucose from carbs. And these are generalized guidelines. A personalized plan from a registered dietitian or a healthcare provider is best for a healthy PCOS pregnancy. Moving on to some lifestyle tips for women who are pregnant with PCOS. The first one, and one of the bigger ones, would be physical activity. This would include moderate exercise. The minimum recommended aerobic activity per week should be 120 minutes. This could include brisk walking, swimming, or pregnancy yoga. Benefits of this would be that it helps with improving insulin sensitivity, helps manage weight, lowers testosterone, and supports mental health. Another really important lifestyle tip is stress management and mental health. Some strategies for this would be incorporating deep breathing, engaging in hobbies, or prenatal yoga. The importance of this is PCOS, as we've talked about, increases the risk of anxiety and depression. So addressing mental well-being is very crucial. Another lifestyle tip is getting enough sleep. So the goal is to prioritize quality sleep for overall hormonal balance, and also it helps with stress reduction. And the last really important one is substance avoidance. So, smoking cessation is routinely advised due to increased risks in PCOS pregnancies, and caffeine and alcohol. So, reducing or completely avoiding these beverages because they can impact glucose levels and overall pregnancy health. In conclusion, having proactive nutritional management as well as lifestyle guided by evidence-based dietary patterns can significantly improve maternal and offspring health outcomes in women with PCOS. Most importantly, having early intervention is key to managing the associated metabolic and reproductive risks. Thank you for watching my presentation, and these are my references.